Your heart deserves protection, especially as the years go by. And yet, there's something most people are never told clearly. The biggest threat to your heart might not be your diet, your exercise routine, or even your family history. It might be sitting quietly in your medicine cabinet. Right now, millions of older adults are taking medications every single day. Pills that are legal, FDA approved, and prescribed by doctors they trust. But those same medications in aging bodies can quietly raise the risk of heart complications, worsen blood pressure, trigger strokes or heart failure, or slowly chip away at balance, memory, and independence. The most alarming part? Most seniors are never clearly warned. Prescriptions are automatically refilled year after year. New pills are added, but old ones are rarely questioned. Dizziness, fatigue, ankle swelling, memory problems all get labeled as just getting older, when sometimes it's the past medications. Today, I want that to change for you. I'm Dr. James, and this is Senior Guide All to All. We're going to look at 5 medication categories that can pose real risks to heart and overall health. After 60 some will be very familiar. Some may surprise you. Every one of them deserves a serious, calm conversation with your healthcare provider. This is not your about panic. This is not your about throwing away pills. This is about understanding where the risks are, what warning signs to look for, and how to protect your heart and independence while still getting the treatment you need. If you care about your own heart or the heart of someone you love over 60, these next minutes could make a real difference. Before we begin, remember, this video is for education, not individual medical advice. Never stop or change any medication based on a video. Always talk with your doctor or pharmacist first. All right, let's start with number 5. Medication group 5. NSAIDs. Common pain relievers with a hidden heart cost. Number 5. NSAIDs. Non-steroidal anti-inflammatory drugs. These are the pain relievers almost everyone has in the house. Ibuprofen, naproxen, diclofenac, and similar brands. When arthritis flares, when your back hurts, when a headache lingers, reaching for these pills feels completely normal. But here's what changes. After 60 these same familiar pills can quietly put real strain on your heart, blood pressure, and kidneys. How NSAIDs stress an older body. NSAIDs don't just reduce pain and inflammation, they also change how your kidneys handle salt and fluid. In a younger body, the kidneys usually keep up. In an older body, where kidney function often declines slowly with age, the balance is more fragile. The result? Your body can start to hold on to fluid. Ankles swell by evening. Shoes feel tight. Legs feel heavy. You're more tired at the end of the day. Most people chalk this up to, I'm just old now. But often, it's your body whispering, I'm overwhelmed. Why your heart cares. Extra fluid means extra pressure in your blood vessels and extra work for your heart. For seniors with high blood pressure, a history of heart disease, or borderline kidney function, that extra work can trigger or worsen heart failure, raise high blood pressure, and over time, increase the risk of heart attack or stroke. NSAIDs can also reduce blood flow to the kidneys themselves, gradually weakening their function. Short-term and long-term use both carry risk, especially when NSAIDs are combined with diuretics, water pills, or ACE inhibitors, ARBs for blood pressure. Doctors sometimes call this combo the triple whammy, a mix that can quietly push kidneys and heart into dangerous territory. Why this feels so insidious. The danger with NSAIDs is that their side effects are subtle. Mild swelling, more fatigue, occasional dizziness. They don't feel like a medication emergency. And because they're over-the-counter, they don't feel serious. That's exactly why so many older adults take them daily, without realizing the load they're placing on heart and kidneys. What you can do. If you're over 60 and taking NSAIDs regularly, don't panic. Don't abruptly stop. Schedule a specific visit with your doctor. Ask, given my age, heart, and kidney numbers, are NSAIDs still the safest option for me? Or, can I switch from daily use to occasional use? Ask about alternatives. Acetaminophen. For certain kinds of pain, safer for kidneys and heart when used correctly. Topical. NSAIDs, creams, or gels that act locally. Physical therapy, stretching, heat, or gentle exercise. For chronic joint pain. The goal is not to make you suffer, the goal is to treat your pain without quietly harming your heart. Shakfar, medication group. Number 4, benzodiazepines, the sleep aid that steals stability. Number 4, benzodiazepines. Medications like lorazepam, diazepam, temazepam, and others often prescribed for sleep or anxiety. If you struggle to fall asleep, if you wake up at 2 a.m. and can't get back to sleep, if anxiety keeps looping in your mind, your doctor may have prescribed one of these. For many older adults, these pills can feel like lifelines. It's the only way I sleep. It's the only thing that calms me down. But there's a serious trade-off that often goes unspoken. What they do to your brain and body. Benzodiazepines work by slowing activity in the brain and nervous system. That's why they feel calming, help you drift off, take the edge off anxiety, but that same effect can slow reaction time, weaken muscle coordination, and interfere with balance. Imagine that combination at 2 or 3 in the morning, half awake in a dimly lit hallway. This is why benzodiazepines are strongly linked to falls, fractures, and hospital visits in older adults. And as you know, one serious fall can change the rest of your life. Cognitive costs beyond falls. Long-term use is associated with memory issues, mental fog, and in some studies, higher dementia risk. At first, it might look like, I'm just more forgetful. I can't focus like I used to. Few people think, is this my sleep pill? There's also dependence. Over time, your body adapts. You may need a higher dose for the same effect. Stopping suddenly can trigger severe rebound anxiety, insomnia, or even withdrawal symptoms. It becomes a trap. You take the pill to feel normal, but the pill may be slowly eroding the very clarity and balance you want to protect. What you can do. If you're currently using a benzodiazepine, do not stop suddenly. That can be dangerous. Ask your doctor, is there a way to reduce my dose safely? Could we try a slow, supervised taper? Are there non-drug options we haven't tried? Evidence-based alternatives exist. Cognitive behavioral therapy for insomnia, CBTI, often as effective as pills for chronic insomnia. For anxiety, mindfulness, breathing techniques, regular light exercise, or certain non-sedating antidepressants that don't hit balance and reaction time as hard. Not every sleep problem needs a sedative, and after 60, that little night pill may be costing far more than it gives. The RIAS, medication group number 3, proton pump inhibitors, PPIs. The silent drain on your strength. Number 3, PPIs, proton pump inhibitors. These are drugs like omeprazole, esomeprazole, pantoprazole, often taken for heartburn, acid reflux, indigestion. They can feel miraculous. No more burning chest, no more sour taste, no more food coming back up. Just one small pill and it all calms down. But here's the part that's rarely discussed. These medications were originally designed for short-term use, yet millions of older adults have been taking them every day for years. How they quietly deplete your reserves. Stomach acid isn't just there to cause trouble. You need it to absorb calcium, absorb magnesium, absorb iron and vitamin B12, and to kill harmful bacteria that enter with food. When acid stays very low long-term, Calcium absorption drops, bones become weaker, higher, hip fracture, risk. Magnesium can drop, heart rhythm disturbances, muscle cramps, dizziness, fatigue. Iron and B12 can drop, anemia, nerve issues, memory problems, things that look like normal aging. Studies have also linked long-term PPI use with higher rates of kidney disease, more gut infections, and in some research, higher heart and dementia risk. Still being studied but concerning? The common thread, PPIs are often continued. Long after the original problem has settled. What you can do. Again, don't stop on your own, especially if you have a history of ulcers, severe reflux or esophagitis, or have been told you must protect your esophagus. But if you've been on a PPI every day for more than 3 to 6 months, and nobody's reviewed it recently, ask your doctor, do I still need a full-strength PPI every day? Can we step down the dose or use it only when symptoms flare? Are there lifestyle changes that might let us reduce this medication? Sometimes relief is necessary, but relief shouldn't come at the cost of your bones, your heart rhythm, and your long-term strength. Medication group 2. Cardiac and blood pressure drugs. When the cure becomes a new risk. This one might surprise you. Number 2. Heart and blood pressure medications. Themselves, let me be very clear. For many seniors, these drugs are life-saving. They reduce heart attack and stroke risk. They control heart failure. They matter. But the same medications that protect your heart can also strain it, or your kidneys, or your brain. If doses are too strong for your current age, combinations are too complex, or nobody has reviewed them in years. Diuretics, the water pill. Diuretics, water pills, help your body get rid of extra fluid and salt. They can ease swelling, lower blood pressure, reduce shortness of breath in heart failure, but in older adults they can also pull too much fluid, drop potassium too low, disturb sodium balance, cause dizziness, cramps, and weakness. That lightheaded feeling when you stand up, that foggy rundown sensation, it might not just be age, it might be that your dose is too strong for your current body. Calcium channel blockers and beta blockers. Calcium channel blockers relax blood vessels, good for pressure, but can cause ankle swelling, slow heart rate, fatigue, and sometimes mental fog. Beta blockers slow the heart, good for certain heart conditions, but can sometimes slow it. Too much, causing fatigue, cold hands and feet, reduced exercise capacity. In people with diabetes, they can even mask low blood sugar symptoms. The bigger issue, aging changes the rules. At 75, your blood vessels, kidneys, and metabolism are not the same as at 55. A dose that was perfect 20 years ago might now be overtreating you. On top of that, many seniors are on one pill for pressure, another for heart rhythm, a water pill, a cholesterol drug, something for sleep, something for mood. This stacking of medications is where we move into our number one risk. But for now, remember, the right heart medications can save your life. The wrong dose or combination can quietly chip away at your strength and independence. Talk to your doctor or cardiologist about a medication review. Given my age now, are all these doses still right? Are any of these drugs interacting to cause low blood pressure, dizziness, or kidney problems? NAS Medication Group 1. Polypharmacy. When the most dangerous pill is all of them together. If there's one medication that scares me most in older adults, it's not a single drug. It's the MAR combination. Polypharmacy means taking 5 or more medications every day. Studies show nearly half of people over 65 fall into this category. Many are on 7, 8, 10 or more. It often looks like this: a pill for blood pressure, one for cholesterol, one for sleep, one for pain, one for reflux, one for mood, vitamins and supplements on top. Each drug individually may have made sense at some point, but together, they create a mixture that was never tested in older bodies with slower kidneys, slower livers, and more fragile balance. How polypharmacy quietly steals health. Every additional medication increases the chance of side effects, raises the risk of dangerous interactions, adds work to your liver, kidneys, and heart. The result is often subtle. You feel more tired, less steady on your feet, more forgetful, less interested in doing things. Your digestion changes, your mood dips. Most people, and even many clinicians, assume that's just aging. But sometimes it's not aging. It's the total medication burden. Even worse, side effects of one pill are often treated by adding another pill. A water pill causes cramps, potassium supplement added. A sleep med causes daytime fog, stimulant or higher caffeine. A pain med causes constipation, laxatives added. This is the Tao prescription cascade. And it can lead not toward wellness, but toward falls, ER visits, hospitalizations, and gradual loss of independence. What you can do. The solution is not throwing away all your pills. The solution is a structured review. Sit down with your primary doctor or a geriatrician or a clinical pharmacist. Many clinics now offer this. Ask for a medication audit or deprescribing review. Which medications are absolutely essential now? Which ones are duplicates? Which were started years ago and never reevaluated? Can any doses be lowered? Can any drugs be safely removed one at a time with monitoring? I've seen seniors go from foggy and unsteady, needing help with everything, to sharper, more energetic, and more independent, without adding a single new pill. All we did was remove what their body no longer needed. Sometimes optimal health at 75 is not about adding more. It's about gently letting go of what isn't serving you anymore. What to do next. If you're over 60 or love someone who is, ask yourself, how many medications am I taking every day? When was the last time someone reviewed all of them together, not just one at a time? Do any of the issues I blame on old age line up with possible medication side effects? You don't have to know the answers alone. That's what your healthcare team is for. But you do have to start the conversation, because the most dangerous pill might not be the one you fear. It might be the one you never thought to question. If you found this helpful, please give this video a like so more seniors can find it. Subscribe to Senior Guide All to All for calm, clear explanations about aging, heart health, medications, and everyday choices. In the comments, share how many medications you or a loved one are currently taking, and whether you've ever had a full medication review. Your story could encourage someone else to ask the questions they've been afraid to ask. And if you're worried about your heart right now, shortness of breath, chest discomfort, strange fatigue, watch the video on your screen next, where I walk through early warning signs that deserve urgent attention. I'm Dr. James. Thank you for spending this time with me. Take care of your heart. It's the only one you've got.